Digital motion x-rays are very valuable when it comes to headaches and posterior neck pain. Let's talk a little bit about C1, C2 instability. C1, C2 instability is one of the leading causes of chronic headaches and weird neurologic phenomenon that seem to be unexplainable by conventional imaging. Patients may have anxiety, they can have what's called cervicocranial syndrome, and that's actually a condition that someone that I know, Dr. Joel Frank, has coined. In this book called The Craniocervical Syndrome and MRI, he pontificates about it. And he's had patients that have had the strangest symptoms that were unexplainable by any nerve conduction study, that you couldn't find any information on from anything except for an upright MRI and a digital motion x-ray study. And digital motion x-rays are valuable when it comes to cervicocranial syndrome, headaches, and C1, C2 instability, because we are able to, here's an example of the occiput, the C1 vertebra and the second cervical vertebra. And in cases of cervicocranial syndrome or craniocervical syndrome, a lot of times people have this going on. So if you can tell, those bones are sliding abnormally. And the reason that's important is because right in this space lies a spinal cord. So if we have a compromise in that space, you could actually completely become paralyzed. So more often, instead of the paralyzing, what happens is that just slides and it irritates that spinal cord right at the base of the skull, which is where the brainstem lies. And the brainstem is responsible for controlling blood pressure, respiration, heart rate, and many other functions, and that's why you get these really weird symptoms. In a non-injured neck, or one that doesn't have that sliding, you have ligaments that hold those bones together, preventing that sliding motion. This is what a normal neck should be like. A lot of times in people that suffer from any kind of whiplash, over half the time, maybe up to 80% of the time, is that they get this, and these bones are sliding. On the digital motion x-ray, we're able to exactly and precisely visualize how much sliding is going on and put that into a report for prolotherapy doctors, for neurosurgeons, to specifically target those torn or stretched ligaments, tighten those, or surgically repair them. So this is a revolutionary procedure because you can't get this information on a static film from the hospital. Very often people don't realize that in the first and second bone in the neck there are no discs. This is the cervical spine, and here you can see that there are discs between the bones at C3 down to C7. In the first two bones, or the top 30% of the neck, there are no discs. There are only those ligaments that we had showed you earlier.